As homelessness in Lawrence remains an issue in the community, service centers like Burt Nash and the Lawrence Community Center are trying to do their part, despite the lack of resources and funding.
When you have a large number of folks who are homeless, there's a flood on the market. So you have a large number of people at any given time trying to find housing, which makes it even more challenging when there isn't enough housing stock or accessible housing stock. And I think that's a key term. There's a lot of housing, it's just not accessible to the population.
Housing's hard. There's not much housing here. I've been trying to get housing when I was here. I've been here for the last 8 years homeless on the streets. And I tried and tried and tried, and it's just jumping through loops and loops and loops.
The reality of the situation is that across the spectrum of service providers, they're all woefully underfunded. And the number of staff, the number of workers that are available to provide services are extremely low in compared to the population of size. And the accessibility to affordable housing is extremely low.
The Lawrence Community Shelter on East 25th Street approaches the issue with an emphasis on housing as the first step before other services are provided.
So we're a housing first organization. That means we offer services to folks along a low barrier philosophy, meaning that we don't require people to take a breathalyzer, or we don't conduct urine analysis for people to access the shelter.
The shelter is currently working with KU architecture grad students to build temporary housing in the form of tiny homes in a village behind the shelter building. It's called Monarch Village, and it opens on May 15th. It's a much better living situation than tents, and offers amenities like a bathroom, a stove and microwave, a community garden, and more. Part of the reason for the project is the difficulty that COVID-19 has been to the homeless community and social services.
COVID-19 has totally disrupted our sheltering system. So it's made congregate shelter, like the Lawrence Community Shelter, an even more untenable, sort of unhealthy sheltering option. It's really risky for staff and guests. In 2020, 30% of the deaths from COVID-19 were congregate care residents or congregate care staff. And congregate care residents are only 1% of the population of the country.
The solution to homelessness in Lawrence is difficult, but there are ways the average person can help.
Honestly, in Lawrence, the reason people come to Lawrence and they are homeless, they're not looking for a solution. This is their solution. They're coming out of pretty much a life crisis. Most people, they're coming out of something, or they can't come to terms with their own life. So this is how we live.
So one thing that the average person can do is explicitly communicate to city, county, state, and federal leadership that they want resources targeted for services and housing. So the solution is to provide housing, to provide shelter, and to provide services. So staff are able to work one-on-one on a daily basis with that population to help them address their needs. Community mental health is built around that model. Community mental health is built around the model of working with people in the community in an integrated way to help them maintain and live as a person just like you and I in the community.
The main thing for homeless, food pantries, that's a big thing. Places to shower, especially with COVID. That's what a lot of people are looking for. You just don't look down on somebody like a piece of shit. I mean, yeah, it sucks, life sucks, but they have to look where we're coming from. They have to go back to the past, they have to, why are you here? How long have you been here? What's going on in your life? Why are you still here?
This is Ryan Butler reporting for KUJH.